Hello, everyone, and welcome. Today, we will discuss how marriage and family therapists help prevent suicide among older adults, an important topic in mental health care. Suicide among older adults is a significant public health concern. Mental health professionals, including marriage and family therapists, have an ethical responsibility to recognize suicide risk and intervene appropriately. Professional guidance from the American Association for Marriage and Family Therapy emphasizes protecting client safety while respecting ethical standards such as confidentiality. First, therapists must conduct ongoing suicide risk assessments. This means asking direct questions about suicidal thoughts, plans, intent, and access to means. Even passive comments such as, I wish I wouldn't wake up today, should be taken seriously. These statements may signal emotional distress and require further evaluation. Older adults face several unique risk factors for suicide. Social isolation and loneliness are common, especially after retirement or the loss of a spouse. Many elders also experience repeated grief due to the deaths of friends and loved ones. In addition, chronic medical conditions and long-term pain can significantly reduce quality of life and contribute to hopelessness. Another key factor is depression. Depression in older adults is sometimes misunderstood as a normal part of aging, which can lead to underdiagnosis. However, conditions like major depressive disorder are strongly associated with suicide risk and require proper assessment and treatment. Marriage and family therapists approach suicide prevention from a systemic perspective, meaning they consider the individual within their family and social relationships. One important intervention is the development of a safety plan. This plan identifies warning signs, coping strategies, trusted contacts, and steps to take during a crisis. When the risk of suicide is immediate, therapists must take crisis intervention measures. These may include contacting emergency services, coordinating with medical professionals, or arranging hospitalization to ensure the client's safety. In such situations, therapists may ethically break confidentiality if necessary to protect the client from harm. Another important component of suicide prevention is collaboration with family members and caregivers. Strengthening family support systems can significantly reduce feelings of isolation and provide emotional protection for older adults. Therapists also use several evidence based therapeutic approaches. For example, cognitive behavioral therapy helps clients identify and challenge negative thoughts, such as believing they are a burden to others. Interpersonal therapy focuses on grief, role transitions like retirement, and relationship difficulties. Behavioral activation encourages older adults to engage in meaningful activities and social interactions, which can improve mood and reduce withdrawal. Finally, therapy should carefully document all assessments, interventions, and consultations. Documentation supports continuity of care and protects both the client and the therapist. In summary, suicide prevention with older adults requires careful assessment, crisis planning, collaboration with families, and evidence based therapeutic interventions. By addressing both individual mental health and relational support systems, marriage and family therapies play a critical role in protecting the well being and dignity of older adults. Thank you for sharing, for watching.